Hi, my name is Carol Taylor. I'm a licensed clinical social worker, and I've been asked by PSI Georgia chapter to provide some information tonight on post-adoption depression. I'm glad that you've all joined us tonight, and I just hope that you'll get some information that will be helpful to do what you need to do to help yourself. So tonight, we're going to start by talking a little bit about what post-adoption depression is. Post-adoption depression is a mood disorder, and it usually occurs post-adoption. So what that means is that basically many of the symptoms that we're going to talk about occur after the child has been placed in the home. And we know that through adoption that can happen in a lot of different ways. But we think of post-adoption depression as something that occurs after the adoption is finalized. So I know from working with adoptive families that there is a difference. If you've had the child even in foster care for a while and then it becomes final that the child's yours, then things start to happen differently. So I think that also can contribute to some of the symptoms of depression that we're going to talk about. What we know is that it is quite common that like postpartum depression, 1 in 7 women and 1 in 10 men experience postpartum depression, but we know that with adoption depression that it's even higher. So there have been several studies out, one by Purdue University that showed that depression is very high with adoptive parents. And in my practice, I've been working with adoptive parents for over 20 years, and I can say that the majority of the ones I see have seen some, have shown some of these symptoms of depression post-adoption. So it's definitely real, and if you're experiencing some of that tonight, I hope that this Facebook Live event will be helpful for you and that you can maybe get the help that you need through this. Let's first kind of start by looking at some of the symptoms that we see with post-adoption depression. Some of the things that we see are, loss of interest, lack of motivation, loss of energy, just very similar to depression itself. But what makes that different is that, you quit doing the things that you maybe used to do that you really enjoy doing, and that can kind of put you in a place of isolation, that your social supports kind of decrease because of that. You are just tired and exhausted, which can increase your irritability and anger. You're feeling hopeless and worthless, and many times guilt is really prevalent with post-adoption depression. There's guilt for all kinds of things, but it is a symptom that we see that many of the adoptive parents have. You have, like I said, the feeling of being tired and fatigued. Taking care of a child can be tiring, but also just the emotional effect of this can be very exhausting as well. One of the studies that we saw that the majority of the people interviewed for that study had experienced an extreme exhaustion and tiredness, which can, also lead to depression. So we know this is definitely a symptom of the post-adoption depression. Another thing that we see is maybe the loss of appetite. Again, you're taking care of a child now that maybe you haven't had in the past. And so either your appetite might increase or it might decrease, but it also can lead to more complicated things like loss of weight or increase in weight gain. So that can also be a symptom of depression that's clinical. We look at depression in a lot of different ways, but the way we kind of decide whether or not it's something that needs treatment, clinical is the term that we use for that, clinical depression, is that it starts to affect your daily life. So if you're having these symptoms, and most people are going to have some of these symptoms at some point, but if you're having them on a regular basis and they are affecting what you do on a daily basis, then treatment would definitely be helpful for you. So we hope that you can maybe assess yourself and see kind of where you are with some of these symptoms, if you have any of them, and if they are clinical to the point that they are affecting what you do daily. Another thing that really I think is kind of different with post-adoption depression than postpartum depression is that the mental struggles that you go through with post-adoption depression. A lot of times I hear adoptive parents say that they just feel let down, that this was not what they expected it to be, that they got this child in their home now, and they're looking at them like, will I ever be able to love this child, or will I ever be able to accept this child? And that, I think, is a different feeling from postpartum depression. And I think for these adoptive parents, they really struggle with feeling just overwhelmed by that and feeling guilty about that and ashamed about that. So that is a mental struggle that I think many of the adoptive parents have. They also have, a lot of times adoptive parents will have the struggle of not having their biological child. And, they got here and many of them have gone through infertility things and have kind of grieved that loss of infertility, maybe have even lost a child in that process. And so there's a lot of grief that's happened already. And it's just complicated by some of these things. Then when the child comes into their home and they're seeing this child and having these thoughts and feelings that they don't want to be having, and then they start to feel guilty about that and just overwhelmed with that. So that's definitely a mental struggle that we see with adoptive parents. Just the loss that's there, many different kinds of losses. And some of it's not resolved when the child comes there. Or maybe it was resolved and the child comes into your home and then you're feeling it again. And so that can complicate the depression as well. Some of the things that we look at are we call these risk factors. Okay, so what risk factors are just things that say that maybe if you have these things that you might have a greater chance of having depression post-adoption placement. That doesn't mean you're going to have it. It just means that it's a possibility. It's a risk there. The risk is higher. So some of those risk factors that we see are a history of depression or anxiety. And many of us have had anxiety or depression at some point in our life. That doesn't necessarily mean you're going to have it post-adoption, but it is what we consider a risk factor. Because certainly if you already have depression and then you have a child and then you start having some of these feelings and thoughts and these symptoms with the depression, then it's going to complicate things for you, and the depression is going to be more likely. Another risk factor that we have that we see is marital relationship problems, like conflict in the marriage, and that too can be something that may or may not contribute to the depression with post-adoption. One of the things that I do in my practice is I work with couples that have adopted children. And the reason I got started with that is that I had worked with many children who had attachment disorders and had post-traumatic stress disorder from trauma. And so I was working with the children and I began to see many of the couples were just falling apart. And so I got interested in that and started working with couples. And I found when I started doing that many of the couples were struggling with some of these same symptoms, but they hadn't really talked to each other about it. And so they may, just because you have marital conflict prior to adoption doesn't mean you're going to have it after adoption, but it is a risk factor. And so just understanding that it's going to complicate things if you already have it. And help is available to help the couples work through that. What I do in my practice is I try to get working with the couples, them to be able just to let their partner become a partner with them in this experience, to share their feelings and their emotions and these thoughts, to kind of, we call the word verbalize, that's the word we use in the therapy world, but to help them be able to say to each other what they're really feeling and get some of those thoughts out in the open and then work through those together. And that really does work with the couples to be able to do that. Another risk factor that we think may contribute somewhat to the depression post-adoption is the financial burden. A lot of times with the adoption process, a lot of financial commitments have been made, and it may leave the couple or the single person in a financial situation that is a stressor for them. And with that, that can lead to some of these symptoms of just feeling hopeless or worthless or helpless and sad and just overwhelmed by the burden of finances. And so that could be a risk factor for depression post-adoption. Another one is infant-child temperament or just some type of special needs with the child. Like I had said, I do work or have worked with children who have attachment disorders. And so this is definitely a special need for a child who comes into an adoptive placement with some type of attachment disorder. This is something we see with older children, with younger children, with international adoptions. Attachment disorder is there, and it can definitely be a risk factor for depression in adoption for the adoptive parents. Because what happens with attachment disorders is that the children are not able to attach to the adoptive parents. And then the adoptive parents then start feeling like they're to blame for that, or like they're doing something wrong, or that, this is hopeless, or that they feel guilty that they can't give the child what they need. And so it's really leads to a lot of the depression that we see, because they need a reciprocal relationship, as any parent and child does, and that's not happening when you have some kind of complication like an attachment disorder. So that is definitely a risk factor for children that have this, and then for adoptive parents who adopt children with some kind of disorder like this. Another risk factor, we think, is being a single parent. And, as part of the adoption assessment process, one of the things that is looked at in a home study is what kind of support system you have. And for single parents who have support systems, there probably is not that great of a risk. But for a single parent who is trying to do this on their own, that can increase the some of these symptoms that we've talked about, just feeling isolated and overwhelmed and irritable and tired and fatigued. And so those symptoms are going to increase, possibly for a single parent. So that's why we consider that to be a high risk. Another one is adopting a school-age child. And again, like I had said before, many of the children who are older have come into adoption through, either through some type of abuse or neglect from their biological parent. And they've experienced a loss. If they are not with their parent, then they've experienced some kind of loss. And so that is a risk for the adoptive parents, because now they've got to help that child grieve that loss, as well as help them be able to form a trust and attachment to them. So that can be a risk for the symptoms for depression to be there for the parents. And then another one that we consider a risk factor is unresolved grief. That can be from all kinds of things. I mean, unresolved grief from infertility, unresolved grief from the death of a child, unresolved grief from the loss of a relationship, either divorce or, there's lots of things, financial losses. But if it's unresolved, if the grief has not been resolved prior to adoption, then post-adoption, some of these symptoms can just be complicated because of that it happened prior to this. So that's another risk factor that we consider is just unresolved grief. Another thing that I think is kind of different in the adoption world today, and I've, like I said, done this for a while, so I've seen some changes through the years, but one of the things that I think is very common today is open adoption. And with open adoption, both biological and adoptive parents experience some of these same symptoms of depression. It may be that the biological parent, selected this adoptive parent. It may be that the adoptive parent was there when the child was born, and that, some things have happened that didn't used to happen. And with that comes kind of these processes of depression or grief that's happening that leads to depression between these two different people, or two, the different parents. And those, many times those relationships continue post-adoption, where there's some kind of contact with the biological mother and the biological father or the adoptive parents in some form or fashion. And so when you already have symptoms, some of these symptoms, and then you're having, that continued relationship with each of the parents, and then those symptoms can be seen with both of them, with adoptive parents and with the biological parents. And so it's kind of like just they're both grieving, they're both having these experiences, but they're experiencing them but not able to communicate that with each other, and that really can lead to a lot of feeling of guilt and sadness and even anger, and again, some of those symptoms that we talked about. So that's the biological parents are experiencing some of these, and the adoptive parents are experiencing these. And when they have contact consistently like that, or some form of fashion post-adoption, then some of those symptoms can increase, and that we do see that happen sometimes. So I think one of the things I really want to emphasize tonight is just how many adoptive parents that I see, that they come through the door and they are so ashamed for having these thoughts and these feelings that they're having, and they're afraid to tell anybody. They're afraid because of the process that has happened, how they got here, to get approved for an adoptive placement for a home. I mean, you go through so much already just to start with. And then you start having these thoughts and feelings, and people don't know what to do with those. They're afraid to tell anybody that they're having those. The fear of what could happen, the guilt that they're feeling for having those, for feeling ashamed that they're having those thoughts and feelings. And so, seeking help is really hard for these families, for these parents to admit that they're having these thoughts and feelings. And I hope that you can realize that just even through this tonight, that there is help available, and that many people are experiencing some of these same thoughts and feelings. And the best way to do that is to seek the help that you need. And in my practice, I work with couples and individuals, but what I try to do is help them work through these thoughts and feelings, help them replace those negative thoughts with positive thoughts about the child, help them explore some of where those thoughts and feelings are coming from, help them acknowledge those feelings and understand that they're okay to have, help them, seek treatment if they need medication, because, depression is it's an illness that has some chemical base to it. And so that's why medication can sometimes help. It can help you be able to, not have those negative thoughts as often, not make you have more motivation, have more energy, make you feel happier. And so I tell some of my clients that, you can seek the help of your primary care physician, or you can seek the help of a psychiatrist, but, medication sometimes can be helpful in these situations, and it's okay to have those. To seek that kind of help. Another resource I think that's out there is that people may not know about are support groups. And for adoptive parents, you can usually access support groups either through an adoption agency. If you adopted through an agency, or even privately, a lot of the private adoption agencies have adoptive parent support groups. Even the state of Georgia, through Department of Family and Children's Services, has adoptive parent support groups. There are also lots of online networks that you can access, blogs, podcasts, different things like that you can go into and have support that way through some of the different nonprofit organizations that support adoptive parents. And there's a lot of them out there. I didn't realize how many until I started doing this, but there really are a lot of nonprofit organizations that are there just to support adoptive parents, and that offer support for depression like this in a lot of different ways. So one of the things, I try to help the parents that I work with try to access those resources they may not know are available. Another resource that I think sometimes they don't know are there are just post-adoption services that are available. There, every in the state of Georgia, every region has a post-adoption coordinator. You can even just Google that, and that list of the different coordinators for each region is available, and you can contact that person. One of the things that they can help you access is respite care. So if you have a child that does have some type of special needs, or requires a lot of extra attention, that you are just fatigued because of the extra attention, you can access those resources through this post-adoption support services. But respite, I try to really encourage some of the couples that I work with to utilize that so that they can rebuild their relationship. And the way respite usually works is it helps the parents can identify a family, and so the child can go to that same family once a month or whatever is needed for that child. So the child feels comfortable going there, as well as the family feels comfortable letting the child go there. So I think that helps couples know that they have some support that way, and then be able to kind of rebuild their relationship. It can also work for singles to have rebuild their social support system through having this time one weekend a month or something to go do something for themselves. That can help with some of these symptoms like fatigue and exhaustion and irritability and just lack of social support. So I think there are resources and things out there that are really helpful for adoptive parents to access. So just finding those resources I think would be helpful for some of the families that are struggling with this depression. So I think that's, kind of what I have to say tonight, really as far as information. Is if there's any other information that you would like to if you have any other comments or anything you'd like to say about anything that we've talked about tonight, you can access this for several days, and then you can leave comments and questions, and we'll respond to those. So, hopefully you've gotten some information that's helpful, and that we can, help you with the depression. It is a disorder, and it does need treatment. Like I said, if it's clinically affecting what you do on a daily basis, then treatment would be what you need. And not to feel ashamed or not to feel guilty for seeking that treatment, but knowing that it's there for your health. So thank you, and hopefully you've got what you needed tonight. Also want to let you know that the next Facebook Live event will be occurring on February 20th. And it's going to be talking about, it'll be at 9 o'clock on November the 20th. And it will be talking about military families and postpartum depression and postpartum anxiety with military families. So thank you so much for watching and being a part of this. And again, like I said, you can access it for a while, and we'll respond to any of your comments or questions. Thank you very much.